Many patients come and see me for a rhinoplasty. They're interested in changing the size and shape of their nose. Rhinoplasty is surgery which is done for cosmetic or functional reasons to alter, change, modify the size and the shape of the nose. A patient may have never liked the shape of their nose. A patient may have suffered from nasal trauma or a nasal fracture at some point in their life. And because of that, they don't like the resultant shape of their nose. Nasal fracture can result in obstruction of the nose, which affects the function of the nose. Or a patient could be born with a condition called a deviated nasal septum, or an acquired defect. Again, a nasal trauma could result in a deviated nasal septum, which means that the cartilage and bony wall that separates the right and the left nostrils is crooked. It's not straight. It's shifted to one side or the other, and what that can result in is nasal breathing problems, congestion, stuffiness, snoring, for example. I have many patients who come to see me for functional nasal issues. They have a problem with their nose. They don't smell well. They can't breathe well through their nose. Their significant other tells them that they snore, or they wake themselves up with their own snoring. They may have allergies. They may have sinus problems. And so the first step is to look inside the nose with a light, or to look inside the nose with an endoscope to examine the anatomy, to determine whether there's a problem with the anatomy inside their nose which would explain their symptoms. And many people have what's called a deviated nasal septum. The cartilage is crooked inside their nose. This can result from a congenital issue, meaning something that a patient was born with, or something that was acquired over time, such as a nasal fracture. If indeed this is the case where a patient does have a deviated septum, the first thing we try is medications, namely topical nasal steroid sprays, to see if we can reduce the soft tissue swelling to help people breathe better, ultimately to relieve their symptoms of nasal congestion or snoring. If medications are not successful, then we move to nasal surgery, and that would involve a septoplasty. A septoplasty is a procedure that is performed commonly. Septoplasty is performed inside the nose. It is not designed to change the shape of the nose in any way. Incisions are created inside the nose. The soft tissue or the mucosa is elevated off of the cartilage and bone and preserved, and the underlying structure, the cartilage and bone, is repositioned, and in some cases removed, and the wall, the midline wall, is rebuilt to create two patent or open breathing tubes or nostrils